Rishi Sunak has appeared on LBC where he answered questions from the public. But before being tackled by callers, the Prime Minister was asked by host Nick Ferrari about NHS waiting lists.
Let me just get this figure out, Prime Minister. It was 7.2 million when you came to office.
Yeah, now it's 7.9, give or take.
Yes, that's right.
Yeah.
It's going the wrong way.
Yeah, but if you look at what happened, I'll just be totally honest with everybody. If you look at what happened, we were actually making progress. We eliminated the number of 2-year waiters. People are waiting a really long time. We practically eliminated the number of people waiting 1.5 years. But the reason, and we were making progress on bringing the overall numbers down, what happened? We had industrial action. Okay. We've got strikes. Now, and look, I've taken a very firm but fair point of view. We've accepted recommendations from independent pay review bodies. I'm delighted that the nurses and 1 million other NHS workers accepted the government's pay offer.
Yes.
And they're working really hard to deliver for patients. But unfortunately, we still have groups of people who are not doing that and they're striking. And that is a reason that the waiting lists are going up. It's as simple as that. I just want to be honest with you. Yes, they are going up. That's the reason they're going up. It's not because we're not putting more money in or doing lots of different things, which no doubt we can talk about on the show.
The waiting lists are going up because of industrial action. It's as simple as that. Is it really as simple as that, Rishi? No, it's not. Spoiler, we're going to go get into the evidence in a moment. First, though, here's what happened when Olivia, a junior doctor, confronted the Prime Minister.
My experience is that frontline services are so stretched that we're in the position that you have had almost all healthcare workers going on strike this year. How do you think your refusal to negotiate with us improves morale or standards of care?
Well, Olivia, thanks for everything you and your colleagues do. You obviously do a fantastic job. What I would say is, look, over 1 million NHS workers have accepted the government's pay deal. Many of them on salaries and incomes far lower than consultants and indeed Olivia and her colleagues. That's just the reality of it. And I'm really grateful to them, the 1 million NHS workers, the several unions, all of whom accepted the government's offer, and the millions of other public sector workers like teachers and others who have also accepted the government's offer based on recommendations from the independent pay review bodies, not the government's view. This is an independent recommendation. Government accepted it. All these other unions and millions of public sector workers, including the NHS, have accepted it. Now, there are a few exceptions, including junior doctors and consultants. That's what's causing the waiting list to go up. I don't think that's right. I would say to them, I'm very grateful and respectful of the incredible job you do, but we all have a shared mission to bring the waiting list down. I've done my bit by backing the NHS with a long-term workforce plan and record funding, and I would ask people to think about accepting what is an independent offer and come and do the thing that I know you want to do, which is serve patients.
I've done my bit. I mean, I just find it so depressing that after COVID, I say this quite often on this show, but I do think it is significant and needs to be remembered that we clap for these people every Thursday. There was, I think, an implicit pledge, an implicit promise made to NHS workers and all carers that we would value their work properly when the pandemic was over. And now you've got a Prime Minister lecturing a junior doctor saying, God, just accept a real terms pay cut. Get over it. Get over it. You know? This is your problem. Your problem that there's a waiting list which is increasing. It's not their problem, by the way, that the waiting lists are increasing. We are now going to look at the data. We'll start with the waiting lists themselves. So according to the House of Commons Library, the overall NHS waiting list have been rapidly climbing since 2020. But before that, they'd been steadily climbing ever since the Tories took power in 2010. Sunak is right that some waiting lists have been going down, and those are the ones he prefers to talk about, as these graphs from Full Fact show. The number of people waiting a year or more has gone down over the last 2 years, but there weren't that many people on those lists in the first place. Whereas the number of people waiting for up to a year, the first two graphs, has grown. And there was no point in the last 2 years where that number has significantly fallen. The nurses first went on strike in December last year, while the doctors kicked off their industrial action this March. So the trajectory of the waiting list can hardly be blamed on them. But what about the longer-term trend? Well, the Tories argue that during their 13-year stint in power, the NHS budget has been protected from cuts. But that's a technicality, because while budgets haven't been slashed, NHS spending hasn't kept up with demographic changes, specifically an ageing and increasingly sick population. This graph from the FT shows how badly the UK has kept up with health spending compared to other countries. The dotted line shows health spending as a share of GDP averaged across the US, Canada, and several Western European countries. As you can see, funding from Thatcher's and Major's governments fell well below the line. The new Labour government that followed increased funding until we hit the average in the last few years of their tenure. But the Tories have gradually dragged us to the bottom again. That freeze on funding has had a huge impact on pay. Again, from the FT, the graph shows how badly nurses have been doing since 2010. By this year, their real terms median weekly pay is now roughly where it was in 2002. Part of those cuts were also to capital expenditure. So that's investment in new hospitals, equipment, and services. This graph shows the number of hospital beds per 1,000 people. Again, we are towards the bottom compared to our peer countries. This one can't be laid entirely at the feet of the Tories, though. The number of beds have been falling since 2000, but that fall accelerated under the Tories, who took us to the bottom of the ranking. So years of underinvestment explains why the backlog for treatment increased from 2010 onwards and why the NHS was in a very weak position to deal with and then recover from COVID-19. And the Tories screwing the NHS is nothing new. Under Labour, NHS waiting lists fell after steep climbs in the Thatcher years. They went up again under the Tories, rocketing during COVID. It's a similar case for A&E waiting lists. Under Labour, almost 100% of people were seen within 4 hours. Under the Tories, that figure dropped to around 50%. So don't give me industrial action is pushing up the waiting list, right? It's a simple story. The Tories pushed up waiting lists, and they do that every time they get into government. This is, if you're looking at correlations, the correlation between the Tories getting into government and waiting lists going up is very, very obvious. You don't have to be particularly good at social science to work out that's what's going on. Let's go back to junior Dr. Olivia for her reaction to Sunak's claims.
I think it's amazing that we're blaming the increasing in waiting lists on doctors going on strike. You're losing staff because we're undervalued, and it's not just doctors, it's everyone. We're all leaving. A happy workforce is your responsibility. You're the Prime Minister, you're the government, your staff aren't happy. That's your fault. And ultimately, that's not good for patients, because retaining staff is one of the bedrocks of making sure that you have good patient safety. You cannot keep the NHS running with the staff shortages that it has. Right. And to keep us here, you have to keep us happy. That is your job. Right. None of us are happy.
I mean, that was so well put. Like, the idea that as a government, you can both increase healthcare outcomes and go to war with the workforce who are responsible for positive healthcare outcomes is just completely bonkers, right? So obviously, under Thatcher, when the government decided to go to war with the miners, one of the reasons they went to war with the miners is because they wanted to shrink the mining industry in the UK. They thought that this was a source of militancy. They wanted to move to a post-industrial economy. So they were like, it doesn't matter if we completely make these people miserable, make them not want to work in mines, make them completely demoralized. That doesn't matter, because our whole strategy for moving forward the economy means that we won't really need miners anymore. But at the moment, what you're seeing is a government who is saying, you're the problem. They're happy to demoralize the NHS workforce. Now, Rishi Sunak is always talking about, the nurses accept 5%, why can't you? Now, the process by which the nurses ended up accepting 5%, I think will have demoralized a lot of people in that workforce. So there were lots of very close votes. You had different unions going different ways. It was all a bit of a mess. I don't think anyone can argue that that was a process which has sort of left nurses happy and satisfied. It was a painful, drawn-out process with a lot of emotional blackmail, saying if you don't accept this, loads of people are going to die, right? It wasn't the kind of process that brought the workers along with the government. And what we're seeing here is the government going to war with a workforce which is necessary, which is the key input to what they think is one of their most important outcomes, which is bringing down waiting lists and increasing the health of the population. It just seems completely bizarre to me.
To me, he's just really like the mundane, banal, like face of evil. I really struggle to watch that interview. And then his odious, I'll just be honest with you. He's just so inherently dishonest. And it's like everything that comes out of his mouth is untrue. And I mean, I know we're talking about the like crisis in the NHS and his attempt to kind of manipulate people into thinking that the cause of this are the striking workers, and it's like a huge issue. But I'm also just, as I'm looking at him, I'm just thinking as well, just about the existential threat that he poses, that he and his policies pose, actually, like to humanity. And I don't want to sound, it's not like hyperbole, but I'm just thinking about like what he's doing in the North Sea with the gas and oil licenses. And I just find him really difficult to watch because I actually, yeah, as I said, he's so boring as well. And I think that actually works in his favor. He's so boring that it's actually quite difficult to listen to him often, which doesn't really matter because usually he's just like everything that he's saying is like completely dishonest anyway. But I really think like what he's doing, the policies that he is enacting, are just like destroying the country, and without sounding too dramatic, like just a kind of direct threat to the world. Like, yeah, I struggle to watch him.
Clearly, the Tories think that the strongest argument they have in their dispute with the doctors is that nurses and other healthcare workers accepted that 5% rise. I see why they keep going back to that. And I mean, in a way, is it a shame for the doctors that the nurses did end up, as I say, in very fractious circumstances, accepting that 5% offer? I mean, I don't blame them. They were under a shed loads of emotional blackmail. They were being told, if you don't accept this, loads of people are going to die. There was lots of division within the nursing movement. They ended up accepting 5%. Do you think it is going to be difficult for the doctors to achieve an amount which is much higher than that after the nurses have gone for 5%?
This provides a convenient kind of excuse for him to keep returning to. That the nurses accepted it, and also it does the work very effectively of kind of pitting people against each other as well. However, even if they hadn't accepted it, there would just be another excuse. There'd be another reason why the doctors can't be given their pay rise. So this has provided kind of like a convenient narrative, but I think without it, that they wouldn't capitulate anyway. It would just be something else. And because there's so much inherent dishonesty, that they would just create another narrative to justify why they can't accept the doctor's demands.